Hello and welcome to this recorded presentation for the employees of Performance Titanium Group for the benefit plan year beginning December 1st, 2022, running all the way through the end of November 2023. My name is Bill Hammett. I am honored to be your insurance broker. My phone number and my email address are on the screen there. I'm happy to help any of you who want some more help choosing plans, understanding the benefits, finding doctors, maybe picking the plan that works best for you given your personal situation. Happy to help. Also available are Rhiannon and Anna. Anna is bilingual, so if anybody has questions about the plans that are you're more comfortable having that conversation in Spanish, Anna is available to you. You're welcome to email her and set an appointment. And throughout the year, we're available to be your advocate and help you in any way that you might need with your health plan, dental, or vision plan throughout the year. Quick agenda, we'll go through the timeline of open enrollment, the medical plans available, dental and vision plans. We'll look at how we enroll. And then, of course, if you have questions, you need answers, we're here to help. What is open enrollment? Open enrollment starts November 3rd, runs through November 11th. This is when each employee can enroll or disenroll. You can add a spouse, remove a spouse. You can waive benefits. In fact, if it is something that you wish to do, which is waive benefits, you do not need them. You still must log in and you still must go through the process. You are welcome to waive all of the benefits. You are not mandated to enroll in any of them. But we do need you to go in each year and decline benefits to prove an offer of coverage is made. So we appreciate you guys doing that. Any changes you made, any additions, any subtractions from your plan, moving from one plan to the next, dental, vision, what have you, those changes will take place on December 1st. Okay, so no matter when you do the enrollment, those changes take place December 1st. We're asking you to complete your enrollment by Friday, November 4th, and you will do so through the Ease Enrollment portal. So we have 8 medical plans available, 5 HMO, 3 PPO. We have our silver and we have our trio HMOs, we'll call them. There's 1 silver, 2 gold, and 1 platinum trio HMO. You'll see there the note in the middle of the screen, the trio HMO equals Scripps doctors. There's more than just Scripps doctors, but the majority of the HMO membership there is Scripps. We know a lot of people like and prefer Scripps, so that's where you're going with. If you buy a trio HMO, you also will see a lot of savings in premium. It's a much lower cost plan because it's a little more limited. The Platinum Access plan is the full network of HMO providers: Scripps, Sharp, UCSD, all the most popular physicians in San Diego that take an HMO are in that network. Our PPO plans are great for people that value choice. You are not stuck inside one medical group. You are very free to move about different medical groups, different medical systems, and self-refer yourself to specialists. So lots of flexibility with the PPO plans, but of course it costs more. So here's our silver and gold HMO plans. We have the 1 silver HMO and the 2 gold plans. So right off the bat, I want you to notice the deductibles at the top of the screen here. These deductibles are higher with silver, lower with gold. And a deductible, generally speaking, is what the insurance company says you must pay all of this number before we pay any portion of your costs. Now, you'll also notice that there is this term DED waived throughout the benefits. Whenever you see DED waived, it means you do not have to meet your deductible in order to get that copay. So if I have this silver trio plan and I need to see a regular doctor, I just pay $60. I don't pay the $2,000 first. I just pay $60. If I need to see a specialist, I just pay $80. My deductible is waived. It does not need to be paid first. If I need blood work, that's diagnostic lab, $55. If I need an x-ray, $100, deductible waived. So you'll see deductible waived throughout the throughout the column, I should say. And whenever you see that, you just know you do not have to meet that deductible first. So when does the deductible apply? The deductible applies in places like where you see after DED. So surgery, hospital stay, emergency room, you see that there's these different numbers and percentages after the DED. So how this would work is I would first be asked to pay the first $2,000 of charges. So if I went to the hospital and I'm on this silver trio plan right here, I would pay 100% of the cost for the first $2,000. Then I pay 40% of the price. Blue Shield pays 60% of the price until my $2,000 plus my 40%, whatever that number gets up to, hits $8,350. Once I have spent out of my pocket $8,350, Blue Shield then goes the full 100% and covers everything. So that 40% only applies to the charges until all of your expenses that you've paid out of your pocket. And by the way, that includes doctor visits, x-rays, labs, prescription drugs. Every dollar is counting towards this $8,350. Once you spend it either with one big expensive hospital stay or with lots and lots of little things like prescriptions or emergency room visits or whatever, once you hit that number, you're 100% covered. All right. There's this pharmacy benefit you're going to see throughout this presentation for many of our plans. It has level A and level B. This is a split tier pharmacy system. Okay. We're going to talk more about that in a couple of slides, but basically it says these pharmacies, you pay less than these other pharmacies. So kind of confusing. I know it's prescription drugs are the number one cost driver of these expenses for healthcare. And we're going to see more and more of this where the cost of prescriptions is passed along to us, unfortunately. So that's the silver plan, higher deductible, higher copays. Now notice the gold trio plan. This gets you into kind of a gold level plan with nice lower copays throughout, lower brand name drug deductible, lower percentages for hospital stays, a flat dollar copay for an emergency room visit versus 50%. You can see how that would add up. So this gold plan is kind of the best of both worlds. It gives you kind of a higher deductible. So if you did go to the hospital, you got to meet this $1,500 deductible first. But paying a little bit more, you're going to get lower copays, lower deductibles for prescription drugs, and really nice benefits for surgery and emergency room. And then there's the Gold Trio 500, even lower deductible, even lower out of pocket, some lower copays, no brand name drug deductible. So a better plan. So these are all just one step above the other in terms of prices. These Trio HMO plans have a special Trio concierge network. So if you call that phone number from 7 a.m. to 7 p.m. Pacific Standard Time, Monday through Friday, you can get help from registered nurses, from health coaches. You can talk to pharmacists, social workers. You can get help with changing your providers, with understanding a claim that's going on or going wrong. Help navigate through the different medical systems. So very good place to start for any of your needs if you have the Blue Shield Trio HMO plans that we've been talking about. Speaking of Trio, we're doing a lot of that. This is what most of you are enrolled in. So we're covering a lot of ground on Trio. The main medical groups, not all of them, but the main ones in the Trio network that are most prevalent in San Diego are Mercy's Physician Medical Group, Scripps Physicians, Scripps Clinic, Scripps Coastal. So those are the main medical groups that are in our network. The hospitals that are in network are all the Scripps hospitals, which is not to say that you can't, in an emergency, go to a SHARP or a UCSD facility. If you are in a situation, you find yourself out in East County, you break your leg, you go to the SHARP Grossmont Hospital, you are covered for emergencies, no matter where you are in the world, really. And so this is not to say that if you break your ankle in Santee, you got to drive all the way to La Jolla, go to the hospital. You go to the nearest facility for emergency needs, which is life or limb-threatening injuries. So let's look at our Platinum HMO plans. We've got two. We've got our Trio plan. Again, this is going to be the smaller network. This is our Scripps doctors. And then we have the full network HMO where your primary care physician could come from Scripps. It could come from SHARP. It could come from UCSD. Great program if you have a family that has different needs of providers that you need. So the HMO plan will allow for that. Notice both of these Platinum plans have zero deductible. Notice they have very low out-of-pocket maximum. So before we were talking about $7,000, $8,000 of out-of-pocket, $8,350, I think that was the number. Here, our maximum risk is $2,350 on this Trio plan. Very low copays all the way across the board. A hospital stay costs you no more than $250 a day. And after 3 days, you don't even pay that anymore. Outpatient surgery, $150. Emergency room visits, $250. So very, very good benefits. This is a great plan for any of you that know you have surgery coming up, that know you're having a baby, that know you have a lot of medical expenses, recurring medical expenses. And this HMO plan, this Platinum Trio plan is fantastic. So I really recommend this plan for those of you that are accessing a lot of care. If you're not accessing a lot of care, you're not going to need a platinum level plan. Notice our full platinum access plus plan, a little bit higher out of pocket, a little bit higher copays across the board, but the attractiveness of this access plus HMO plan is the size of the network. So remember we talked about that tiered pharmacy network. We had level A and level B. So very specifically, again, that concierge number we talked about, that's a good place to start if you forget any of the presentation, but you just know there's certain pharmacies you should go to rather than others. You can call the concierge number, but also see on your screen here, CVS, Costco, Safeway, Vons. Okay. So I just always remember CVS and Costco. Okay. CVS and Costco. We like to do things at Costco anyway. This is where you're going to have the lower copays. Places like Rite Aid, they're going to be in the level B pharmacies. So you want to kind of try to do your best to be a good consumer, smart consumer, save some of your own money. Lots of CVS's and Costco's around. So as well as Vons and Safeway. So that's the tiered pharmacy network. We have 3 PPO plans. Again, PPO is going to give you choice. You're going to pay for it, but it's going to give you choice. So more cost, more choice. Now you see here we have similar things that we saw with our HMO plans. Silver plan has a $2,000 and some dollar deductible, highest out-of-pocket max, highest copays throughout the whole thing, bigger brand name drug deductible. So these silver plans are attractive to those of you that want the choice but don't have a lot of needs, or maybe you just have doctor visits and maybe you just need some prescription drugs, but you really want to have the choice. A silver plan is great for you. For those of you that need the choice and you know you're going to be utilizing a lot of healthcare, I would recommend you look more at the gold plan. And if you need a lot of medical attention, if you need a lot of things serviced within yourself, then the platinum full PPO plan is the very best plan we got. Fantastic plan, no deductible, low out-of-pocket maximums, low copays, only 10% out of pocket in the hospital. And again, the max is $4,500. The gold plan, lower deductible, $500, some tolerable copays across the board. Also a very good plan. Again, PPO, more cost, more choice. So talking about our dental plans, we've got HMO and PPO. Our 3 HMO dental plans are bronze, silver, and gold. All of them use the same Delta Care USA dental network. They have copays across the board and no annual maximum. So when we get to PPOs, you will see that there is an annual maximum benefit that they pay for. But with dental HMO plans, they're very attractive because there's not ever any annual max, and every single service you'll go through is a copay. Okay, so no matter what it is, there's hundreds and hundreds of different copays you pay, but everything's a copay, so your expenses are managed. It's also very attractive to those of you that just really want a couple of free cleanings a year. That's the only really thing that you need as far as from your dental provider. And so dental HMO plans will keep the cost very low so you can get those free cleanings. And if something comes up, you can also access care. Last thing about dental HMO plans, smaller network. Okay, so HMO plans by rule are smaller than PPO plans, so not quite as many providers in the dental HMO network. Dental PPO, much larger network, much larger price. Okay, so you're going to pay more. There's some of us have very specific preferences with our dentist. Maybe we've been with this person for a very long time. Maybe we trust this person. Sometimes those kind of providers are not in the HMO network. And if you wish to have a dental insurance plan that would cover some, most, or all of the care, then the dental PPO plan might be what you need. There's the PPO Silver plan, great for people that don't need a lot of work, but when you do, you want to go someone in particular, not a super high price point, but there is a maximum benefit of $1,000. This is the main drawback of a PPO plan, is that there is calendar year maximums. So you see with the silver, it's $1,000, the PPO gold is $1,500, and the platinum, it's $2,000. This is the point at this dollar amount. Once we reach this number, once Delta has paid $1,500 for me on the PPO Gold plan in benefits, cavities and root canals and crowns and whatnot, they don't pay any more for the remainder of the calendar year, and you pay everything else. All right. So getting a dental PPO plan has 2 major limitations. Number 1, it's expensive, and number 2, there's a calendar year maximum. But choice of provider is very important to many people, and this would be the way to go And if you want the most choice, pretty much the most choice you can get, you go with the Platinum plan, which uses the Premier Network, which is one of the largest PPO networks in the country. Very, very good. Very, very good depth and breadth of providers. Let's talk about vision plans quickly. With our vision plans, we've got two options. We got the Gold and the Platinum. Both of these plans are exactly the same in every way except one. They both give you a $10 copay for an annual eye exam. Once a year, $10 eye exam. They both give you a $25 copay for new lenses once every 12 months, once a year. But the Gold plan gives you your $180 allowance for frames or voluntary contact lenses or elective contact lenses, $150 allowance, gives you that once every 2 years. The Platinum plan gives you those benefits once every year. So that's that last 12 versus the 24 on our screen here. This 24 means every 24 months you get $180 for frames or $150 for elective contact lenses once every 2 years. And the Platinum plan gives you those benefits once every year. So remember, this is an or, this is not an and, that 180 versus the 150. Gives you that every 12 months. This Platinum plan costs about $23 a year more than the Gold plan, but it gives you $180 of tax-free benefits. So I love the value of the Platinum plan. Nothing wrong with the Gold plan, but the Platinum plan is a better value in my estimation. So let's talk about enrolling in all these plans. So as we have in the past, we're using our enrollment platform. We call it EASE. The hyperlink for you would be embedded in an email you're going to receive. But for those of you that wish to go straight to it, it's performancetitanium.ease.com. It looks just like this page here when you log in. For those of you that have never logged in, you'll create a password here and then you'll log in. For those of you that have before but maybe forgot, you can hit the little forgot button right there. You click the login button and you're into the system. Now, getting into the system, all you need to do is keep your eyes peeled for this email. It's going to say, now open employee benefit enrollment portal, mandatory, blah, blah, blah. We've changed the date on this. I apologize. You'll hit the login button, the green login button at the bottom of the screen here. You'll go to a page that shows you a green button at the top right. You start enrollment. Takes you to another page that gives you an idea of what to expect. For those of you that are re-enrolling in what you had before or declining outright, this process will not take you anywhere near 15 minutes. It'll take you 5 minutes. It's very easy. Hit start there. Enter all your personal information. Notice all the asterisks. There's a lot of them. Medical plans. So here's where we're going to get to our medical plans. It looks just like this. As you start down the screen, you're going to see a big box that says specify your coverage. For those of you that are enrolled already, it'll already be pre-selected how you're enrolled. But with those of you who are enrolling for the first time, it's going to be gray. The check mark is gray as well as the X. So you must hit the check mark in order for you on the next page to see these buttons that say select. And then once you hit one of them, it'll say selected. There'll be a big green box that goes around it. So very important, this part of it. We see most people skip right by this and get here, and there's no select button, and you don't know how to select anything. So you want to make sure you do that. For those of you that are already enrolled, you're going to see the same plan selected. You'll see a number of different links underneath that take you to helpful documents that can help you find doctors, understand the plans, download ID cards and stuff like that. Then you review your plan choices. If it's not correct, you hit the edit button, you go back and you fix it. Otherwise, continue. Turns into DocuSign from there. You'll hit the sign forms button, wait a minute while it loads applications. You'll type your signature. You'll use your mouse to write your signature or your finger if you're using a mobile device. Hit next. And it'll take you through the whole process of plugging your signature into all the different parts of the application. Once that's all done, you'll hit this tiny little finish button at the top right. And then you know you're done when you get the email that says your benefit elections have been submitted for review. Once you get this email, you are done. There's nothing else you need to do, okay? So that's what you're looking for, is that email. So speaking of emails, you're going to be getting an email. It's going to be coming from the EASE portal. It's going to look just like this email we talked about a minute ago. It's just like this, now open employee benefit enrollment portal. This might arrive in your junk folder, so check there. You're going to log in there and choose your benefits, decline your benefits, change your benefits, whichever you'd like to do. The deadline to enroll is Friday, November 11th. If you have any questions, you need any answers, I'd be happy to help. Our team is happy to help. and we appreciate the opportunity to be your broker. We're proud to be that, and look forward to speaking with you. Thank you for sitting through this presentation. Bye-bye.